Bismillahirrahmanirrahim. Today we will discuss the topic of exhumation. Exhumation is autopsy. It may be first postmortem or it may be a second postmortem. When the relatives or family friends of the dead are not satisfied, they think, in their opinion, it is unnatural death. Then they can simply apply to the district court's district session judge on a simple paper without any fee. They are supposed to write an application, and then on receiving this application, the district court may consult the district authorities that so and so was buried, say 1 week, 1 month, or 1 year or more time ago, and is it of any use to do autopsy of that person after its body is taken out of the grave and then autopsy. Then, and if the medical authorities say that yes, it may be helpful to the law, then district court order for exhumation. And the team consists of number 1, magistrate, because it is a type of magistrate inquest. Number 2, doctor, some police personals, and doctor with its team that consists of 2-3 morticians. No society is ever free of crimes. Pakistan is a sort of underdeveloping society. So many problems. Sometimes death is unnatural, but in our system, because police is the authority, so SHO, if satisfied, death may be unnatural, but he can issue order, okay, death is natural and bury. Or death may be natural, but SHO is not satisfied and he will ask, no, I need autopsy of this. In this case, a married lady was murdered, and actually it was supposed that she had electric current. Because of that electrocution she died, but on investigation it was proved that she was actually throttled along with poison. First poison was given and then she was throttled. In this case, again, autopsy of a dead age about 8 years. Autopsy was performed after taking his dead body out of the grave after its burial. Sometimes the relatives are not very comfortable with the first postmortem. In this case, postmortem issued by the doctor, but in their opinion it was not correct. So they asked for the exhumation, and on exhumation, some fault in the medical legal report or autopsy report issued by the doctor was proved wrong. Exhumation is actually disinterment of the dead from the grave after its burial for autopsy to find out the cause of death, mode of death. And especially if the relatives are not satisfied, in their opinion they think that death was unnatural. It is example of magistrate inquest. The team nominated by the district magistrate consists of a magistrate on duty, doctor, along with the 2-3 morticians, 2-3 police personals. The aim of police is for the protection of the team. Grave is identified by the relatives. Area is wall off, cordon off by use of tentage, and autopsy is most of the time performed there in the grave. Dead body is, after digging the grave, dead body is taken out of the grave, identified by the relatives, and on a proforma, on obtaining signature of the doctor, it is handed over to the doctor. The doctor along with his team will do autopsy there, and if possible the dead body may be taken to mortuary, but most of the time autopsy or postmortem performed there in the graveyard. Aim is to find out any foul play. Samples must be taken, and if the dead body is putrefied and it is difficult to identify the organs, even whatever the tissue scrapings are left, that should be taken for sample for identification of any poison or any foul play. These samples are properly preserved, dispatched to the forensic laboratory to find out any cause of death. Samples must be taken in case of exhumation. And some sample from the graveyard, say about 50 yards away from the grave, of this soil must be taken. Sometime, if that area is full of arsenic, and arsenic may get entry into the dead body, this is called arsenic imbibition. And the aim of taking sample of that soil that is about 50 yards away from the grave, from the same graveyard, this sample is also sent to find out what is the amount of arsenic present in the soil. Hazards of autopsy. It is exhumation is also autopsy, sort of autopsy, medical legal autopsy. The doctor and its team are exposed to various hazards, and these hazards are mechanical, maybe biological, chemical or electrical, radiological. And how to prevent these hazards? Autopsy protective dress, including shoes, thick rubber gloves must be worn, protective eyeglasses. Insulate all electrical appliances. In case of needle prick, remove the glove. Allow to bleed, wash thoroughly and apply antiseptic dressing. Get all the workers vaccinated against infectious diseases. After the doctor has issued the report, the law is supposed to verify it. Autopsy report is an example of medico-legal report. Other examples of medico-legal report are age certification, dying declaration, injury report. And the doctor, once issued this report, may be called in the court to verify this. So double check on the deck. First, when he was writing this report, he was away from the court. Now he is asked to appear in the court and explain what he has written, how a doctor should behave in the court. Number one, he must be properly punctual and properly dressed. He must address the court as sir. He must not use technical words. So instead of saying clavicle, he must say collarbone. He must not involve into lengthy conversation of the advocates. He must not lose temper. He must not smoke or busy with the mobile. The court is listening. If even the questions related to the character of the doctor may be asked from the opposite part. Doctor is cross-examined, and this examination in the court is after taking oath. So doctor is verifying his report, whatever he has written, under oath. And before leaving the court, doctor must get permission of the court, and so, if required, court attendance certificate from the court. And when doctor is asked to appear in the court as a witness, he is actually supposed to be in the court as expert witness, but doctor may be a common witness, expert, or even a hostile witness. In the court, doctor is asked to appear as an expert witness. He is allowed to consult his notes because the case may be 1, 2, 3 or more years old. And if doctor is asked to appear on the same day in two courts, he will first attend criminal court and inform the civil court accordingly. And if on the same day he is asked to appear in two courts of magistrate. He is supposed to appear in the senior court, higher court, and then in the lower. Or if he is not available, he must inform the lower court accordingly. Summon are issued to witness, and doctor is a witness, and these are signed by the court himself and always issued in duplicate, served to the witness. That may be a doctor, it may be a witness. One copy is handed over to witness, that is to the doctor, through police or any official of the court, and other copy, after obtaining signature of the witness, that is the doctor, is returned and kept in the court for record. If some witness, maybe doctor or anyone else, is not obeying the summon deliberately, then court may issue warrant. Warrant may be bailable or non-bailable, and warrant is actually issued to the SHO of that area. Court is ordering him that so and so witness is not appearing in the court, so that person must be forcefully brought in the court, maybe after arresting him, maybe after handcuffed. So doctor must be careful. Problem in our society, people who are enjoying their life, well-off people, not so educated, and they are enjoying in the presence of their friends. And this, I am showing the slide. The well-off person, he asked his servant, okay, you stand in front of me in the presence of my friends with some bowl on your head, and we will hit. And that servant was unlucky because he was hit by the bullet, so was unable to survive because of injury to brain. A dead body was recovered in the field, maybe in the jungle, and police is supposed to do investigation. Police is doing it, and actually it was some love affair problems. Consent is very must essential for the treatment, and doctor must keep in mind this. Younger boy, as a patient, is not willing for any injection, so he is not consenting. Marriage is a contract, and contract is to be signed, and anyone who is signing the contract must be mentally fit, and after signing he can't refuse. That he is not. Certain conditions need written consent. For example, surgical procedures, when the age of the patient or individual is 18 years or above, or for marriage or some other contract, or for blood transfusions, or for the examination of private parts of a person. Person identification. Ladies are also sometimes integral part of the gangs. They are also young, and how they hide their identity, and as it when required, they prove their identity for others who they think that they are also belong to the same group. One of the aim of autopsy is to find out the cause of death and any other associated crime along with that death. Sodomy in this case. Pakistan Medical Dental Council is important topic of medical jurisprudence. Medical jurisprudence deals how law controls medical practice. Doctors are registered, and this registration of the doctor may be cancelled if proved wrong, if proved false. Injury is important topic of forensic medicine. Injury may be antemortem, may be postmortem. This report of BBC. The black deers, which are very costly in India, they were attacked by dogs, and some died because of injuries produced by the dogs, whereas the other died because of heart attack. And the dogs also, eat busy. The dogs were busy in eating their flesh, and this flesh eating wound produced on their body was post-mortem, and it was not the cause of death. Similarly, a person may be walking on a road and he may get heart attack. It is possible, and after 1 or 2 minutes or sometime he may be hit by a vehicle. Then confusion is produced whether cause of death is roadside accident or disease. Which is differentiating, which is helping the law, so that no culprit escape punishment and no innocent must be punished. The red chili powder may be used as irritant poison. They may be thrown into the eyes of someone, and it may facilitate in robbery, rape, or other crimes. In this slide, someone got married second time and he was not comfortable with the first wife, so he tried to disposed of, killed, and at the same time he produced mild injury on himself, posing that it was a case of dacoity and he was protecting his wife and got injuries. The injuries which are friendly hand are self-created. Self-inflicted injuries are always on the body parts which are within reach, and they are never on vital organs, and they are mild. They are just abrasions. This female, no one is angel. The evil forces are present in our blood. And this female was a medical student studying somewhere. In this case, a story was that this lady, mother of 6 children, she took some poison and committed suicide. Actually, it was a case of fatal injuries, body injury, physical assault, and she was throttled to death. Zinc phosphide is organophosphor compound. Organophosphor compounds are used as insecticide, fungicides, spray on the crops. Aim is to kill the unneeded or non-required weeds, and also to preserve the seeds for the next crop. In most 60% of our population of Pakistan are related to agriculture, and sometime when they are angry with each other, not commonly but sometime, it is possible that this zinc phosphide, which is also essential element of rat killing paste, this is available in the market as tablet, though taste is not good, but when someone has decided to commit suicide or to kill someone else, then this drug zinc phosphide available in the tablet, maybe of 3 gram or less, is offered to that person in some sweet liquid, maybe syrup, maybe ruafza, and even if the person during swallowing this realizes that something wrong, he has taken sufficient amount of zinc phosphide, was able to get into his body, so fatal outcome is expected, because the dose is just 1 gram. People, because of poverty in Nepal and in this area, in subcontinent, they are busy in the drug trafficking. On autopsy, the intestines were found full of capsules containing hearing costly medicine. And sometimes these capsules in the intestine may rupture, so overdose of this may be cause of death of the individual who's carrying it. Accidental death is possible in our setup, in every setup. For example, snake bite or thunderstorm, electric thunderstorm. Sometimes this is a case of throttling. Aim is to constrict the respiratory passage externally by using the hand. If some ligature is used, then it is garroting. No injury is produced in this case, but aim is to kill someone, to dispose of anyone, and even no weapon is required. Aim is to stop breathing, again depending upon the physique of the victim, general condition of the victim. The victim may be not in is unable to fight, is unable to defend, or is not fully conscious. Samples collected are preserved, and the preservatives in our setup we use mostly saturated supersaturated solution of sodium chloride, and they are preserved. Other preservatives are rectified spirit, or for tissues formalin is used. Forensic Science Laboratory is established in Lahore, and it's quite a good laboratory. And the scientist, chemical examiner, is an example of expert witness, and he is so busy that he is rarely called to appear in the court. His report is sufficient. The samples are taken in 3 bottles, and in 4th bottle the preservative used that is dispatched. First bottle will contain stomach and its contents, second bottle small intestine with its contents, and third bottle liver, spleen and kidney. All these and 4th preservative which is used. Preservatives are used to prevent any putrefaction, and they are properly sealed, labeled, mentioning date and autopsy number. The after examination in the laboratory, report is issued by the chemical examiner. Poison is not detected in the above viscera, and this report is issued to the police, and police will produce this report in the court. Investigating officer in our setup, in more than 90% cases to the police, and police is the authority, SHO. In this slide, I want to mention that things are to be used and people are to be loved. One must be careful about his words, his actions, because action may become habit, and habit may become character. Assalamu alaikum.